So, thank you guys for being here today. I am very excited about this particular conversation because you guys know we have been talking a lot more about what the heck is GI psychology, how can it help me, and there's been some new developments with Rome 5 and new diagnostic criteria, and we're just very excited to continue the conversation. So today we have the wonderful Dr. Ellen Joseph with us, and she is part of the group GI Psychology. And we're going to just kind of break down what is GI psychology, and you guys will have the opportunity at the end. You can type the questions in the chat. We'll open it up to a little bit of Q&A, but if you think of something and don't want to forget, just throw it in the chat and then we can bring that up later. Just a reminder to please mute yourselves just because we are recording. And if you don't want to be seen, just remember that the camera, you can turn your cameras off if you don't want to be seen. But otherwise, we are going to focus in on Ellen, and you are good to go. And I will stop talking.
Thank you all so much for being here. So, I'm Dr. Ellen Joseph. I'm a counseling health psychologist and partnership liaison at GI Psychology. I'm excited to talk a little bit more about gut brain therapies today. What are they? What does it mean? What can I expect? I'm hoping that you all walk away from today feeling like you have a clear picture of what these treatments can look like, get any questions answered about what you can expect. So let's dive in. I do want to note that the information I'm sharing today is educational in nature and definitely should not be used in lieu of any medical advice on your treatment teams. Please, of course, consult your own healthcare providers. They're going to have a much better picture of your comprehensive care plan than I will. So just want to keep that in mind as we're proceeding through our talk. Okay. So the gut brain axis and disorders of gut brain interaction. The gut brain axis is a very dynamic and multifaceted system in the body. And I bring this up because I think often it gets really oversimplified. So I want to take some time to talk about what are all the components. We're not going to go in a deep dive with all of these components today, but my big takeaway I want you all to have from this slide is there are a lot of systems involved in here, and this is a complex dynamic system. Um, all of these components that I'm listing here can influence the functioning of our gut. And for many of us, and I would argue probably almost all of us, there is some combination of different pieces here going on that can influence how our gut is functioning. So, one, and this is a topic that's getting a lot more attention lately, where we also still have a lot more to learn, is the gut microbiome. So, the gut microbiome, all the different type of bacteria in the gut, the what we used to call good and bad bacteria, and how they all work together, and what's the right balance. At the end of the day, we know that the gut microbiome sends signals to the brain through things like metabolite production. So, there are messages going to the brain from our gut microbiome. A big piece also is our nervous system. So, a common nerve that I hear about a lot these days is the vagus nerve. You all might be familiar with it. That is encompassed within our autonomic nervous system, which is very much influenced in our gut brain axis, as well as our enteric nervous system. So, this is the nervous system within the gut. Also, the HPA axis and stress. So, chronic stress triggers this axis to release something called cortisol, which is a stress hormone. And that can increase things like how permeable our gut is, how much things can escape from it or come in, and dysbiosis. Also, hormonal communication. So, our gut is a major production site for hormones in our body, as well as neurotransmitters, which are examples of these are like serotonin, norepinephrine, dopamine, GABA. And microbes influence these levels, which can influence, therefore, our brain chemistry. So, again, this like back and forth between these key parts of our body. And lastly, our immune system, our immune signaling is involved in our gut brain interaction. So our gut cells release cytokines, which are like little messengers within our immune system, which once they cross into the brain can cause inflammation. So when we think about our gut functioning and you look at this, you're probably thinking, whoa, that's a lot of different pieces to the puzzle. And also why sometimes this puzzle can feel confusing because for each of us, how these components interact can really influence how our gut is functioning overall. Now, as a gastropsychologist, my work really heavily focuses on the nervous system and the HPA axis and the gut brain axis communication. Our nervous system plays such a critical role in how we experience sensations in our body, particularly in our gut. And yet, so far in science, we have no way to measure how our nervous system is functioning. And this is like a big piece that I try to explain to folks. This is still biological and structural. We just, as science, haven't really caught up to figure out how can we tell somebody how their nervous system is functioning, if it's working too hard, if it's not working hard enough. When we think about the gut brain axis, we think about the communication via the nervous system between the brain and the gut. So this includes our central nervous system, so that's our brain and our spinal cord. And then, as we talked about before, the enteric nervous system, which is the gut. We need these two to communicate. This is how we know things like when we're hungry, when we're full, when we need to have a bowel movement, if we're sick and we need to get things out of our body because we've acquired a virus. We need this communication system to be functioning. For a large majority of us, this communication system can go awry and start talking too much, is how I like to explain it. It gets oversensitized. Multiple things can contribute to this: genetics, infection, chronic stressful life events, maybe a prolonged bout of constipation or diarrhea. And now all of a sudden, the gut and brain are talking way too much. They're over communicating. So if you look in the bottom left of this image, visceral hypersensitivity is something that can occur when the gut and brain are talking too much. And that's when normal sensations in the gut are getting magnified and distorted. So what this could mean is a gas bubble, maybe after a meal, comes through as severe pain, or hunger comes through as nausea. And what we're feeling doesn't match the signal that's occurring in our gut. So then our brain does what our brain does best, and it starts working. And it's saying, hold on, these sensations do not feel good. Something must be wrong. And now it becomes hypervigilant around the gut without you even having to think about it. This is just what our brain does to protect us. And now the brain is scanning the gut, watching out for those warning signs, trying to find these patterns that sometimes then the brain is working too hard and is being more hypervigilant to the gut, which then is sending stress back down into the body. So we get caught in this really vicious cycle when this occurs, which can result in disorders of gut brain interaction. Things like comorbid physical and mental health concerns can exacerbate this cycle but not be reduced. Like the cycle can't be reduced to them. And I say that specifically because some folks may have experienced someone saying, oh, well, if you were just less anxious, you wouldn't be having these sensations in your body. Okay, false, 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 false. Anxiety can play a role, but it is not the singular piece to the puzzle. But it can exacerbate that cycle if we have that going on, for example. I want to pause here for a moment just to see if there are any questions. I think this is a really critical piece to understand before we move into like why we use gut brain therapies and how they work. So are there any questions right here to talk about regarding the gut brain axis?
We have some in the chat. Do you want me to I will answer that yes, the slides will be available. You don't have to take notes. We are recording just to answer that question. But the only other one is how do issues like SIBO and emo impact the gut brain connection? Do you want to answer that one here or hold off till later?
Yeah, let's add it in here because I think it kind
Perfect.
of speaks to some of the comorbidity piece, right? So when we think about SIBO, when we think about emo, there is overproduction of certain gases in the gut, which is going to create discomfort. Then we intersect that with an already sensitized gut brain interaction. That's going to be really uncomfortable, really painful, and can be exacerbated even further, the symptoms. So think of them as like a piece to the puzzle, and that these two parts can function and influence one another. This is actually why we see them very commonly in occurrence with other disorders of gut brain interaction.
I have silence. So if you want to keep going, if any other questions come up, you guys can just throw them in the chat or raise your hand. I'm keeping an eye out.
Perfect. Perfect. Okay. So let's talk about the gastroparesis functional dyspepsia continuum. So we know on paper, I don't know how we got these red marks on here. Are other people seeing this, these like lines, or is that just on me and my end? Oh,
I see it, but
okay.
I think you're good.
So they don't mean
Adds
anything if you're
character.
looking at them, just adding a little flair. Yes. So on paper, the distinction between gastroparesis and functional dyspepsia is mechanistic and test based. So gastroparesis we think of as delayed emptying, and functional dyspepsia we think of as normal emptying. The thing is, we as patients can cross these lines in both directions. And what we're understanding is this is better viewed as a continuum versus two distinct experiences, that someone can move along this continuum in different parts of their journey. With that being said, things like diabetes, post surgical vagal injury, and some other drug induced cases probably more classically cluster in the gastroparesis box only. Um, but what's important here is that these two diagnoses share a core gastric neuromuscular or gut brain biology. So we think of delayed emptying on one end and we think about normal emptying on the other. But really, how we're currently labeling them, we're trying to slice them in this really arbitrary way, which we're finding is really unhelpful for folks. And that instead of looking at it as one or the other, perhaps we move along the continuum and need different treatments and approaches based on where we are on the continuum. So I just want to name that because this is something that folks are hearing more and more in their medical visits. Like, how do I know if it's one or the other? Right. So that brings us to, what do we do about it? Where do these gut brain therapies fit into the picture? Now, I want to name, in case folks listen to Sam's podcast with my colleague, Dr. Ali Navini. He talked a little bit on the podcast about right now, our evidence is limited around the use of these treatments for gastroparesis, which is a problem and definitely a need. Although I will say clinically on our team, we have a team of over 15 clinicians. We've seen really promising results from these treatments for folks with gastroparesis, but more needs to be done here to understand the full picture. So what are these treatments? So the first one is cognitive behavioral therapy for GI. And there are a couple things that this can support with. Relaxation training, learning how to physically and mentally relax your body, which is a lot easier said than done, but learning different techniques and strategies that work well for you to promote feelings of relaxation and calm. CBT also helps with something called attentional training. So if you think back to that image I showed you earlier about that hypervigilance, if our brain is on high alert all the time, our nervous system is really activated. And then we're really zoomed in and paying a lot of attention to our gut sensations, sometimes even if we don't want to, we just find ourselves doing it. So, the role of attentional training is, how do I learn to shift my attention away so that my nervous system can regulate a little bit more? So, I'm not kind of in this panic cycle and scanning for these sensations and getting more and more nervous, and then they're getting worse, right? We want to kind of break that cycle and be able to take breaks and shift our attention away. And then, how do we get our brain to work for us? So, CBT helps us figure out what are ways that I can reframe and shift my thinking in a way that supports me and helps me. This is not rainbow sunshine butterflies. I am not a proponent of like toxic positivity because that's also incredibly unhelpful and invalidating. It's the goal is, how do we find more balanced, moderate ways of thinking about our experience that can help reduce the distress that we feel in the context of symptoms? CBT can also help with reducing avoidance. So, something we as humans are really good at is trying to control and shift our environment to help us feel less anxious. So, we end up making rules. Okay, well, these foods are off my list. I can't go to this place. I can't leave my house after this time. I've now quit all my activities. Then we find ourselves in this position where we're like, man, my world feels so small. How did I get here? I'd like my world to feel bigger again. There are things I really care about that I want to be doing. So we work with you as clinicians to figure out, how do we help you get to those places safely and comfortably so that we are expanding your world back out in a meaningful way. And then we also can use techniques to help reduce the fear that can come along with certain sensations within the body. And when I say feared but safe, I mean that sensations that we know based on our work with our medical teams, that we can assuredly know that I am okay and I am safe in this scenario. This is maybe one of those visceral hypersensitivity moments. So on the right side, I have an example of what this can look like and kind of how I map this out with folks in treatment. So in the top right, you see a situation or trigger. This is just something that, either typically occurs in our life or one-off happens in our life. One could be waking up with an unsettled stomach, or bloating or pain after eating are common ones that I work with folks on. And then the brain immediately starts thinking, because that's what our brain does. It starts to react to make sense of what's happening in our life. And sometimes this thinking can be really fear based. Oh no, this is not a good start to the day. The day's only going to get worse from here. I better stay close to the bathroom so I can make it in time. Remember that time you didn't make it to the bathroom in time, which naturally those thoughts are going to bring up some uncomfortable feelings: frustration, fear, anxiety, anger, sadness. So then we act on them. We're calling out of work. We're canceling the meeting after lunch ahead of time. We're leaving work early. Maybe some of us find ourselves jumping to start researching our symptoms online, even though we've researched them maybe 5 or 10 times before, but we're looking again because maybe there's something else there that we've missed. And then the sensations worsen and we get caught back in the cycle. So I work with folks on shifting this cycle in a way that can help reduce that emotional distress by shifting our thinking and shifting our behavior. Any questions about this one? We're a smaller group, so I'm happy to answer as we go along. Okay. So I thought we'd play a little game of misconceptions that I've heard about CBT before. And then so that'll be the missed it, and then we'll nail it and we'll fix that misconception a little bit. So the first one, if I need CBT, it means my gut issues are all in my head. You're saying that I'm making this up, and if I just think differently, everything will go away. Incorrect. That's not how we think about CBT. It is not all in your head. CBT helps to address a mind that is working too hard and potentially contributing to the gut distress. Our mind can play a role, but it's not that all your symptoms are all in your head. So that's a really important distinction. It's a tool that can help, but it doesn't mean that you're making this up. Another one, CBT teaches you just to be positive. I just have to be a positive thinker, and CBT will help me do that. I actually really try to shy away from the word positive a lot in treatment and use words that are more like balanced and helpful thinking. So CBT helps us move towards a more balanced and helpful perspective. And helpful is really dependent on you. What do you care about? What do you want to look at differently in your life? How do we help identify thoughts that help you feel more balanced and less distressed? CBT is a one size fits all. I'm going to work with this clinician. They're going to be like, see, 1, 2, 3, 4, 5, here's what I have to do, and onward and upward. No, CBT is very collaborative and tailored, and we very much individualize this treatment in partnership with you. So we work with you as a team, from the patient and the therapist, to figure out what is going to work well for you and what shifts are going to be meaningful for you. I often will tell folks, I'm going to give you an example of what this sounds like, but I want you to put it in your words because I want it to sound authentic to you and specific to you. My words probably won't fit because that's my brain, not yours, right? So we're really working to figure out what's going to work best for you. CBT doesn't help if my thoughts are realistic. So let's think about living with a chronic illness. There are probably many thoughts that you experience that you're like, heck yeah, it makes sense. My brain thinks that. I've had that experience before. It has gone that way before. Things can be negative in this experience. And the answer is yes, that is true. And these thoughts can be very much grounded in fact in your experience. And what we can do is use CBT to shift your attention to those thoughts, unhelpful behaviors related to those thoughts, or even your relationship to the thoughts, even those that are realistic, when they're in a situation that is not helpful for you. So let me give you an example. Let's say you're sitting and you're talking with a loved one, and you're maybe like talking about this funny story that you all were a part of. Maybe you're reminiscing this like really fun memory. And now all of a sudden your brain is super locked in on your gut and like panicking about the worst case scenario that could come. Well, now that's pulled you away from that conversation that's really meaningful to you. Might your thoughts be realistic? Sure. And they're pulling you out of the moment doing something that's really meaningful. So, how do we help you in that moment get back to the thing that's meaningful to you so that you don't walk away from that situation like, man, I totally like checked out of the last hour of that conversation and then not feel great about that? So, how would you know if CBT would be helpful for you? I said this before, but if you're finding your world feels really small, smaller than you would like it to be, specifically because you're trying to avoid gut distress. That could be a good indicator that this could be a helpful treatment. You find yourself thinking a lot about things outside of your control, things that you think will happen in the future that haven't happened yet, or things that have happened in the past that you can't change now. And you find yourself kind of stuck in the future and the past and kind of struggling to be here in the present, dreading things that you used to enjoy and or dreading the future, finding that you're not feeling that sense of meaning or motivation because you're so afraid of the symptoms that you're experiencing or the condition that you're living with. That worst case scenario thinking, our brain can be so imaginative and good at this, right? Of like painting this picture or playing this movie in our head of this really bad thing that could happen that hasn't happened yet. We can work on that. We can adjust our thinking in a way that helps move us away from kind of living in this movie that is really scary and yet has not occurred in the present yet. Wrong way. Just thinking about your gut symptoms a lot. A lot of people who come to me and they're like, I just don't want this to be the thing that I think about all day. So much of my brain space and energy is spent thinking about my gut and caring for my gut and planning for my gut. I'd like to find a balance that works better for me. So that's something I hear a lot. Doubting your ability to cope with your symptoms. So this could be emotionally, this could be mentally, this could be physically, but really kind of doubting yourself and struggling to have that confidence, struggling to get back into that relaxed, calm state before, during, and or after your GI symptoms. So sometimes people describe me like, I just feel like I'm like, my nervous system is kind of like on fire all the time, or I'm just constantly in this activated state and I don't know how to get it to calm down. That could be another time. And perhaps if you have a history of an anxiety or depression, or it's developed while living with a chronic illness, when you find that they're worsened by the GI condition, that can also be a way in which CBT can be helpful. I think I saw a question pop up in the chat. Oh, some podcast. Oh, Sam's sharing the podcast. Great. I'm interested in the mixed message the brain gives to the stomach or reverse. Cheryl, do you mind telling me a little bit more what you mean by that? I just want to make sure I'm answering it.
Sure. Sorry, it goes way back to an earlier slide, but
Oh, no worries.
I couldn't get into the chat, so I wasn't sure how to do it. But it had to do with you said that sometimes the brain will send a message, let's say like nausea, when it really means hunger, or it
Yeah.
sends something else and it really means this. And
Hmm.
I'm thinking, oh my gosh, I get that so many times where I feel really nauseous and I hadn't eaten in a while. And I'm thinking, okay, it was from something I ate hours ago, but it
Yeah.
really may be because I'm hungry. And sometimes when I do eat, then I feel better. So
Hmm.
how do we change that mixed message, or how does that work, I
Yeah.
guess, is my question.
Oh, Cheryl, it's like you were teeing me up for my next set of slides. So, Cheryl, what you're describing is a really good example of visceral hypersensitivity, where this like mixed message coming through. And then the question is, okay, well, if I have that, how do I turn it down, right? How do I get the more accurate messages to be communicated between my brain and gut? So let's talk a little bit about that.
Wait, before
Or,
you even do that,
yes.
how do I calm down after this whole presentation? I'm feeling totally stressed. Just thinking about my stomach and all the stuff you said in the last slide.
Yeah.
Yeah, it's like
Yeah.
even
No,
though
I hear you. I hear
the
you.
presentation is so important
Hmm.
and so what do I want to say? Intricate with all of what we're feeling, and yet it's making me feel more anxious watching it. So I don't know if I should just
Good
record
question.
it. Yeah, watch it later, maybe in
So
bits and pieces.
perhaps at the end, we could all as a group talk a little bit about a quick tool we could do together as something you can even take away from today as a place to start. So, I want to shift a little bit here to clinical hypnosis. I might have some folks on here that are like, oh no, I'm losing her now. Like, we're not going to talk about this, are we? Hang in there with me. I will fully admit, I was very hesitant about clinical hypnosis as a practitioner because I did not know the evidence basis behind this tool before I learned about it. My experiences were like when I was in high school and this was like our senior night show and the football players like quacking like a duck on stage. So when I became a psychologist, I thought, I'm not going to do that to anybody. That seems terrible. Okay, good news. We're not doing that to anybody. Clinical hypnosis is very different from entertainment hypnosis, but that's really what pop culture shows us a lot of, this entertainment hypnosis where the hypnotist is like controlling people's minds, We see it in the movies. They're like waving the watch, they're snapping their fingers, magic words, and like people are out of control. It's a very magical, it's there for the awe factor. Okay, we don't do that as clinicians. We use clinical hypnosis. This is an empirically validated treatment where we teach patients to go into something called trance, which is portrayed a lot in pop culture, but it is very different when we're in clinical hypnosis. Trance is simply a combination of concentration and imagination. In fact, everybody on this call already experiences trance in your life. So let's say you're, driving somewhere familiar, you have a favorite, music, I was going to say CD, but back in the day, favorite playlist on. Maybe you're listening to a favorite podcast, and you get there and you go, I don't even remember like did I make those turns? How did I get here? I like don't really remember the drive. That was a trance, a light trance. You go to the movies and you come out 3 hours later and you go, that was 3 hours? Like, we just got in here like 10 minutes ago. How has it been 3 hours? Or if anyone on the call has teenagers who have cell phones, those kids are in trance when they are on those cell phones. You're talking to them and they're clicking away and you're like, hello, I just said 5 things to you. And they're like, I didn't even hear you. So this is trance. It's a very naturally occurring state. We teach folks how to go into trance on purpose, and then we help to facilitate change in this nervous system communication so that these sensations are really more accurately perceived, to Cheryl's question. So, how does this help? Clinical hypnosis does help, we say, in CBT, or almost make it a little bit easier to use CBT skills in the moment. It just like uses different parts of our brain to really deepen the learning that comes from CBT. It helps relax the smooth muscle in our gut. So I have folks tell me, like, after we do a hypnosis session, like, I was having some movement. I think I need to go to the bathroom. Like, go, let's hang up, like, go use the restroom, right? Because hypnosis really helped to facilitate and relax those smooth muscles. There's a lot of research behind using hypnosis for pain management. So, turning down the intensity of the pain, both in acute and chronic settings, to help create more comfort in the body. And I'm going to tell you in a few minutes how we do that and what's an example. To Cheryl's question, reducing that visceral hypersensitivity. So, now all of a sudden, I'll have folks tell me in treatment that nausea that I was experiencing, I started to feel hunger again. I got a different sensation and it felt more accurate this time. And then in hypnosis, which is a little bit different sometimes from mindfulness meditation, I'm actually helping you learn to shift your attention away from the sensations in your body. So, how are we helping you to get a break from being hypervigilant and really attuned and feel a sense of calm and relaxation in the body and getting that nervous system to settle more? All right, so missed it and nailed it because this is one with lots of misconceptions. My therapist will be controlling me. No, I am not in control of anyone that I am working with. In fact, spoiler alert, if you close your eyes and you're going, this is dumb, this is stupid, this is not going to work, it will not work. You are in control the entire time, and you won't do anything in trance that you won't do while you're awake. I like to describe it to folks like, I'm the passenger in your car, you're driving the car, I'm holding the map and I'm saying, you might consider turning right here. And then as the driver, you get to decide, do I want to turn right there or not? But ultimately, you are in control during clinical hypnosis. Hypnosis is just like mindfulness. If I already do mindfulness exercises, I don't need hypnosis. The structure of the exercises is very different. The techniques we use in hypnosis are very intentional and targeted to the gut. And we see differences in brainwave activation. So while there can be similarities and themes across them, clinical hypnosis is very distinctly different from mindfulness meditation. Hypnosis is the quick fix I'm looking for. I just got to schedule one appointment with Dr. J and it's going to fix everything I've been experiencing. I wish I could tell you I had that level of magic and power. That is not how clinical hypnosis works. Benefits from hypnosis build over time and through practice, and it's not a magic trick that makes all of your challenges disappear. This is a tool that you are learning to utilize yourself through your therapist support. This is not a magical one-time thing. Only weak-minded and gullible people can be hypnotized. That has been debunked by research. So the vast majority of us have some level of we call hypnotic talent. and can benefit from clinical hypnosis. You just need a little talent to be able to benefit. You don't have to be on the far end of the spectrum where you get really deep in trance. You can still get benefits on this whole spectrum of hypnotic talent. So, how would I know if clinical hypnosis would be helpful for me? Your gut sensations feel distorted. We had talked about that one. Your gut sensations feel really magnified. So, fullness becomes severe bloating, distension, or even pain. And you're going, I ate an amount of food that I would expect to feel okay in my body. Why am I feeling this level of distension and pain? Maybe you're looking for a non medication option. And you want to try something that doesn't require another pill or medical intervention for your pain, for your nausea, for your constipation. Maybe you struggle to use CBT skills outside a session. So sometimes people tell me, like, yeah, Dr. J, that makes a lot of sense. Like when I'm in session with you, yeah, like shift my thought to something more balanced. That sounds great. But when I'm in the moment, I really struggle to really use that skill in a way that feels helpful. Hypnosis can really help get over that hump and really feel the benefit from CBT skills. This also can help when you're having difficulty feeling relaxed or safe or at ease. And we know that these feelings can sometimes feel few and far between when we have really severe GI distress, and also can be really powerful if we're able to elicit those feelings within our body. Struggling to shift your attention away from your GI symptoms, even if you want to, there are ways that we can utilize hypnosis to make that easier and more doable for you. How do we feel about going into some examples when you're like, okay, all sounds great. What does this actually look like? Okay, seeing some smiles, some nods. Okay, so here's some CBT examples and how we might use CBT strategies to help. So think about a situation when you're getting ready to eat lunch and you think about how you typically feel pain or even nausea after meals. So first with hypervigilance. So we start scanning the body. We're waiting for that first sign of nausea or pain even while we're eating. Ooh, is it starting yet? Is it starting yet? Should I stop here? Is it about to come? Ooh, maybe I should hold off. So what we do with CBT skills is we might incorporate diaphragmatic breathing. We might incorporate safety phrases. I am safe. I am eating a food that is comfortable to me. I can make it through this. I will be okay. Things like that. Scheduled check ins. So I will check in with my symptoms once every 20 minutes for 2 minutes. But after those 2 minutes, I'm going to shift my attention elsewhere and then I'm going to come back and check in again. So trying to reduce the amount of that hypervigilance and scanning. Maybe around mealtime, you're experiencing catastrophizing, where the brain just starts getting really anxious. Maybe you're saying things to yourself like, I should only have 1 or 2 bites, even if I want to eat more. Or this nausea and pain is going to bother me so much, it's going to screw up my meeting. So the brain is already working on how bad things are going to get. Maybe we work on building new thoughts like, let's try one bite at a time. And I'll keep reassessing after each bite. Maybe something like, I don't have enough information yet to decide how I'll feel after my meeting. I'll cross that bridge when I get there. So these are ways that we can shift the thinking to try to reduce some of the distress. Maybe you feel a lot of emotions and sensations around this experience: fear, worry, frustration, stomach pain, nausea. And we work on shifting those to feeling calm, feeling more confident, feeling open and more at ease physically. Or maybe if you're experiencing a lot of avoidance, so skipping and canceling things. Maybe you're skipping the meal altogether, canceling the meeting after lunch, or leaving work early. You tell yourself, I'm going to eat lunch anyway. I'm going to keep the meeting or I'm going to stay at work. And I'm going to really work through this experience to try to not make my world small. So these are ways that we try to help you move towards in the green using CBT strategies. Questions about these before I move to hypnosis? Okay, I'm taking the silence as like we're following, but please stop me at any point if there's a question. All right, hypnosis. So this is fun. We get to use a lot of fun metaphors in hypnosis. And when I say fun, I mean creative, tailored to you, and makes sense based on how you're experiencing your symptoms. That's what makes metaphors really powerful. It really aligns with your experience. So with nausea, we have this technique called the control room where we can create different dials within your mind and imagining turning those dials up and down. And when you do this in a hypnotic trance, you can actually shift how you experience the sensations in the body. We can use metaphors like the tide settling to imagine the nausea settling. Some people really like the idea of a cool sensation when they're feeling nauseous. So it's like they're breathing in cool winter air that's like spreading through the esophagus and into the stomach and creating this really cool, settled feeling. Or sometimes we use metaphors around protective coating. So you're imagining protecting the inside of your GI tract in a way that nothing can bother it or anything that would bother it to be really mild. And you want to imagine as medication? Is it this really soothing drink that you enjoy, but something that can protectively coat the inside of your GI tract? Maybe if you're someone who experiences pain, control room can be another really helpful tool. We'll use metaphors of like a volume dial. Can you imagine like a dimmer switch where you're just gradually pulling that down and the pain sensation is decreasing the more and more you pull down the switch? Some people like warm or cool sensations, depending on your pain management and what feels good to your body. We can elicit those warm and cool sensations in hypnosis without the help of, say, ice or a heating pad. There are also ways that we can teach you to distance from your pain, so making the pain feel further away so it's less intense and impactful. And then with early satiety or feeling full quickly after a meal, again, the control room is a really great technique. We can use a metaphor of a balloon deflating. We can talk about like a room with adjustable walls to create more space within the body so it feels less uncomfortable. Or even the idea of like a gentle conveyor belt to help support motility and moving things through the body in a really gentle, easy, natural way. If you're having a feeling right now of like, this sounds a little woo woo, Dr. Ellen, I totally understand. And I've seen it really work for folks. It's a really powerful way of getting at these really uncomfortable things in the body when we can find those metaphors and images and experiences that really work for you and really connect to how you experience your symptoms. So, what could you expect from gut brain therapy? So, what you can expect is you're going to work with a gut brain therapy expert who really wants to learn more about your specific experience. So, while diagnosis is helpful for us to understand like the cluster of symptoms or kind of where in the body the distress is occurring, every person's experience is different, how it influences their life, when the symptoms come up, what makes them worse, what makes them better. So you're going to have an expert on these diagnoses who really want to get to know your experience because you are the expert on your body. And we are here to help you figure out what's going to work well for you. Active engagement. So gut brain therapy is not like a chit chat, we're like besties on the call kind of treatment. We are here to very actively build coping strategies and help you experience change in your life. So it is a more active treatment. Individualization. So while we have tools that we know generally can work with different folks and different experiences, I use so many different hypnosis sessions for the folks I work with, for example, or tailor those CBT strategies based on what works for you in your life. Experimentation. I love to tell you that every single thing we suggest is a home run and works perfectly. It won't be because that's not how life works. And I actually find in treatment, when we find the things that don't work, that actually gives us a lot of good information to help us figure out even more what will work. So expect an experimentation approach and mindset and some collaboration with your provider and seeking feedback. What is working? What isn't? When do you feel better? When don't you? So that we can tweak the experiment again and try again next week. Improvement over time. So, kind of going back to that hypnosis slide, changes are cumulative and you will continue to experience more and more improvement over time. It's not a one stop shop. Collaboration between your treating providers. This is really critical. We are all on your treatment team. I'm preaching to the choir here. We have multiple folks who we're working with, and it's important for us as providers to collaborate, even if we're not under the same roof or system. So that's something that gut brain therapists are going to be incorporating into your care. Request for feedback. That was the other piece I had mentioned earlier. We want to know what your experience is. I don't find it helpful if someone's like, Dr. J, everything you say is great. I'm like, I can't imagine that. Tell me what isn't great. Like, tell me what didn't click for you so that we really can make it better. Because ultimately, we need this to work for you, particularly outside of sessions, right? Because a lot of this is happening between appointments. All right. What questions do folks have? I think I just saw one.
Do you
Yeah.
want me
Oh,
to read
Marissa.
it or you got it?
Yeah, I got it. Yeah, Marissa, great question. So it can vary, right? So I work with folks with incorporating hypnosis at all different points around mealtime based on what we're noticing is happening before the meal, is happening after the meal, is happening during the meal. There are even tools that we can utilize that are a little bit shorter in nature. that you can use that are kind of a quick 1 to 2 minute tool. But we can put them really anywhere in the meal because these tools can be preventative and reactive. And it really is figuring out what works best for you. But there's flexibility with that. How do you find a qualified hypnotherapist in your area? Great question. So, GA Psychology is a fully remote practice where we actually serve the entire country. We're able to see people in all 50 states. There's also the Rome Foundation has a therapist finder, if that's another place that you want to look as well. With GI Psychology, we are fully remote. I know some people really prefer in-person therapy sessions. Or if you're looking for somebody who specifically takes your insurance, that could be the Rome Foundation therapist finder could be another good place to look.
Can you spell that foundation, please?
Yes, here, I'll put it in the chat.
Thank you.
So a session typically lasts 45 to 50 minutes at our practice. I don't want to speak for how other folks do it, but we meet with folks weekly at GI Psychology, and our goal is to be time limited. We see on average about 13 sessions at our practice for folks to meet their treatment goals. And for reference, what I'm looking for and what we're looking for as a team is at least a 50% symptom reduction, and or significant improvement in your overall life functioning. These are all really good questions. Does GI Psych take insurance? Genevieve, I'm assuming you're talking about us as a practice, but let me know if you meant something. Okay, great. So GI Psychology, we're an out-of-network provider, so we don't directly bill to insurances. We do support folks by providing super bills for out of network mental health benefits, which a lot of the commercial insurances have as part of plans. Another really great option that we find to be really viable is something called a gap exception or single case agreement. And this is where you ask your insurance, okay, give me a gut brain therapist who's in network, who's in my area. And very frequently, the answer is we don't have somebody. And in that case, we help you fill out the necessary paperwork to help justify the need for this specialized service. And then you get reimbursed as if we were in network. So you can expect up to 80 to 100% back in the treatment cost. And we have these accepted about 70 to 75% of the time. And this isn't exclusive to GI Psychology, just FYI. So if you do have other very specialized and niche treatment providers like us, this is an option that you can look into on your insurance.
I did put in the chat in case anybody missed it, but Dr. Navidi did talk about this a bit on the podcast episode as well, because that's something that comes up a lot. Like, is this expensive? How will my insurance cover it? Or I don't have great insurance. So how can I still get the thing that I need? So that's toward the beginning of the podcast episode. If anybody, I promise I'm not plugging myself, but also am for everybody to go in there because there is some good information.
I will say too, sometimes I recognize that out of network can be challenging for some folks or a concern when you're thinking about a treating provider. I have had patients that I've started with who've told me, I can do X number of sessions, given this cost. What do we think is a reasonable goal? Here's what I'd like to work on. And we do that. We take those sessions and we make the most of them. So we really want to be able to support you all in the best way we can and work within what makes sense for you. One session probably is not reasonable, though. I do want to name that. One session would probably not be a very reasonable treatment experience. Wish I could say it would be, but I also like to give realistic expectations. And then I think there was another question too, is it considered CBT? It's CBT for GI, so it's a specialized form of CBT, as we kind of went through a little bit earlier, and clinical hypnosis. And then you get to decide with your treating provider which treatments ultimately you feel comfortable with and want to move.
I'll ask a question.
Yeah.
So, how would maybe you suggest talking to or explaining to family members like what the gut brain connection is without them saying, so it's all in your head then? Because we already have such a hard time explaining the symptoms to our family members. So, when you add this in, what would you suggest is a good place to start for that?
Yeah. Okay. I think metaphors, obviously, I use metaphors a lot in treatment, but I think this can really help move away from sometimes the technical language and help people really resonate with what you're describing. So, if you've ever been on a beach and you're like laying out in your chair and it's like a beautiful day, and maybe you have like, your, favorite little drink, or you have someone that you really are close with next to you, and you're like getting ready to lay back and plug in your earphones or AirPods and listen to your favorite playlist. And you lay back and you turn it on, and the sound is turned way up. Like, jump out of your chair, you're ripping out your headphones. Maybe it was your favorite song, but you're like, "Oh my god, that was so painful. What is going on?" And you get startled, right? You feel I mean, I imagine some people might even be by me, like, giving this metaphor, right? It activates your nervous system. That's visceral hypersensitivity. It's a good song, but it's way too loud. And we need to be able to turn down the volume on the song so that we can be comfortable again. The same way now that you've had this experience at the beach, maybe the next day you come back and you're like checking the volume before you even put your headphones in because now the brain is more vigilant. Now it's like, oh, well, I don't want to have that experience again. I better make sure that this volume is turned down. So that's what's happening with the hypervigilance and the visceral hypersensitivity feeding off of one another. So we need to get the volume down on the music, and we need the brain to know that we're safe and we can handle it and we will get through it. I wonder if that feels helpful, Sam, as you think about explaining it to family members.
Yeah, I was just gonna say, I'm gonna use that, thank you.
Yeah.
That's helpful because I
Yeah.
know, that's we have a hard time. I mean, I know I'm speaking for myself here, but for a lot of people that we've talked to, that when you have these diseases and you have these issues, it can be hard to explain that to somebody who's not living in your body. So then
Right.
when you add this other layer to it, it brings up questions that are hard, like, for at least for me, make it a little harder to describe, like, where that connection is, why, when my anxiety or stressors are worse, other things happen, and it comes back to this, so it's all in your head, right? Like, no
Yeah.
wonder you're in therapy. That's not it. So anything, I think, for myself and anybody else that can really help differentiate that and really show what this is and how that can be helpful is helpful. Words
Exactly.
matter, and it's good to have things to say because sometimes my responses aren't the nicest ones.
Fair enough. We also, if it is helpful, we have a Brain Bites video series. It's totally free on our
Mhm.
website. It's a six
It's
video.
wonderful.
Oh, thanks, Sam. Where we like break these different pieces down. So even if you wanted to like send that to a family member, like, hey, hear from the experts. This is what's happening in the gut brain connection, or why these therapies are helpful, and maybe also like take the pressure off of you to have to explain it.
No one else has a question, I'll throw another one at you. So, what would be the difference between, like, symptom management and just coping?
So I think that depends on the person, the diagnoses, the spectrum we're working with. I think sometimes when we talk about, I never want to go into a treatment with someone and say, like, I'm just like, we're all resigned to the symptoms, right? Like, I really want to work with you to figure out, can we make some subtle shifts? Can we make some meaningful gains for you where you are feeling more comfortable physically, while also being realistic about not being able to fully maybe flip a switch, right? So, how do we navigate this uncertainty and unknown where we can find areas of gain and improvement while also learning, okay, this is something I'm going to experience every now and again. How do I savor and enjoy the periods of relief? Because I think that's really critical. Sometimes our brain does not want to do that. And then how do I feel a sense of self efficacy and confidence when I am navigating symptoms? And what can I pull in that will help even turn the dial down a point or 2 points on the symptoms? So I look at it with a lot of nuance, understanding the person I'm working with, their diagnoses, their experience to figure out what feels realistic and trying to find that balance.
Thank you.
Hmm.
There's a question that popped into the chat too. How often would you recommend doing clinical hypnosis audios? Is there an amount of times per week that is most effective?
Yeah, good question, Marissa. So the clinical research trials that have been done on gut-directed clinical hypnosis, and the vast majority have been done with IBS. I do want to name that, although we're getting better with expanding across different DGBIs. The research that has been done recommends 4 to 5 times a week in between therapy sessions. Now, I work with people that are like, nope, not going to happen. I don't have 4 to 5 times a week in my schedule. So we adjust. So I think it's about what is going to work for you to build the skill and to reinforce the practice, and what feels feasible that also you're going to feel a sense of accomplishment between our appointments versus like, and I didn't get the 5 again, and I didn't get the 5 again. I've seen folks experience benefit across the range because I do think if we're setting goals that are unrealistic, that is really defeating in treatment and will impact how you're feeling about your progress. But the research, when they did it, did do 4 to 5 times a week in practice. Yeah, these are all very thoughtful questions.
Very thoughtful answers too.
I'm gonna switch to I'm still happy to answer more questions, but I wanted to give, our website and information in case folks are interested in having that. And I'm okay with folks that are like, "This was a little woo-woo, like, can you help me understand this more?" I do not mind it. It's important, right? I think it's healthy to keep a little skepticism and curiosity about treatments. So I'm happy to answer those kinds of questions too.
You guys can just unmute too if you want to. I know not everybody likes to do that, but you can feel free to unmute and just do what I do and just start talking.
I I would, I've been when I got to my gastropsychologist that specialized in gastroparesis or um, my gastroenterologist who specialized in gastroparesis issues, her recommendation, and this was at the end of 2020, her recommendation was, that, of a team which included the gastropsychologist and the dietitian. And I've been going since I think around January or February of last year was my first appointment. And we started off with the hypnosis. She does an intro group of 8 sessions every
Great.
week that she does with a group. And then we did on one, we've done some personalized sessions of is symptoms have changed and different things. But I would say that it's probably the most helpful part of the treatment, um, because it also, um, it's the brain gut, and it's also the lifestyle, like, what lifestyle changes do you need to make? How do you manage life? How do you manage life, um, with gastroparesis and, like, what you were talking about, like meetings and social functions and things like that. And I just wanted to add because I always listen, even though I already had one, I listen to see if there's anything I could learn or new. It just reinforces how critical a piece it is
Yeah.
to the treatment because sometimes, like, you go frustrations with just the medications, getting the medications and their availability and costs, and, you go through weeks where you feel like you're spending more times in doctor's office than you are working and things like that. So, the hip having those recorded hypnosis sessions from I think I have about 14 or 15 of them now,
Yeah.
and I, um go through and there's different scenarios and I sit and listen depending on where I am and what I feel because it it gastroparesis affects so much of what you can manage and not manage. But the hypnosis just helps, um, the 30 to 45-minute sessions, listening to them. It helps that, like, where, if eating, you need to eat, and that's been a really big thing is you need to get nutrition, you need to keep if you're still eating, solid foods and how to keep that because that's an important piece if you're able to eat solid foods, if you're able to overcome, um, things like I've had foods that, like, I should be able to manage to get down, but I had, like, an episode with nausea or something after them, and they were fine before, but now since I had that episode with nausea, I can't eat that food. So we've been doing some sessions with that. We did some of the training, I forgot, IB something, DR, it's that PTSD, uh
Mm. EMDR?
yes,
Mhm.
and we've done some of that and just different things so that you it helps to keep it help it's helped me, I think, from having some of the symptoms progress,
Yeah.
um, and managing other ones that are typically unmanageable. but manage them within my life versus of the unmanageable. So I think it's such an important piece.
Thank you so much for sharing that and being willing to share your experience with everybody. It's one thing for me to say it as a clinician. It's so powerful to hear it from folks who've really experienced that change. So I thank you for being willing to share that. And it sounds like it's been an incredibly helpful tool. It's part of what we're trying to do at GI psychology too is educate medical providers who don't have this resource available to them to let them know it exists, and let's engage in this multidisciplinary team from the get-go. We don't even have to wait. Let's get the team on board so that folks can experience change like you've described. So thank you, Andrea.
Yeah, I'm lucky because 'cause I'm in Chicago, so I'm at,
Yep.
Northwestern Hospital, which
Yep.
has an amazing
Yes.
GI center, and
Yep.
they have all of these people within the same office.
Mhm.
So it's not an overwhelming of going from department to department, as we find, in so much of our healthcare.
Yeah, definitely, definitely. No, Northwestern is a great center. Well, if other questions come up, we don't disappear as a practice. I want to name as well, if you're just curious, we do provide free 15-minute phone consultations. You could always meet with one of our patient care coordinators and just learn more and then ultimately decide what feels good to you. But here is our admin email, our office phone number, our website. We have blogs and different resources on there as well. So we don't disappear after this, and thank you so much for having me today.
Yeah, thank you for being here. I don't need to tell you how much I love what you guys do. I tell you all the time, but this has been such a great resource, and we all know how much little information that we get as a whole for gastroparesis care. And we, as an organization, continue to try to find people like GA Psychology and others to really help get you guys more of what you need. So, Dr. Joseph gave you all of their information to reach out, but you can always reach out to us as well if you have any other questions or you're not sure how or maybe what type of questions you might want to ask. So you can always reach out to us too. And yeah, so thank you guys so much. And hope you learned a little something today.
And if you are feeling a little activated, if you want to look up a quick video on diaphragmatic breathing, that can be really helpful just to kind of help recenter after this. I wanted to come back to that, Cheryl, before I forgot.
Thank you.
Yes, you're welcome.
Thanks, everybody.
Take care, folks.